heart is a remarkable organ that beats tirelessly to keep us alive, but it is often the most neglected one. Did you know that cardiovascular disease or CVD, commonly called heart disease, is the #1 cause of death worldwide? The annual number of deaths from cardiovascular diseases in India was estimated to be nearly 47.7 lakhs in 2020. Globally, 85% of CVD deaths are due to heart attack and stroke. CVDs also account for 45% of deaths in the 40 to 69-year age group. These numbers are not just alarming, but also scary. But the good news is that heart health can be improved and heart attacks can be prevented by up to 98% through lifestyle measures. So let's explore the fascinating world of heart health and learn how to take charge of our cardiovascular well-being. First, let's understand how the heart works. The heart is a powerful muscle that pumps blood to all parts of our body, delivering oxygen and nutrients to our organs and tissues. It has 4 chambers, including the left and right atria and ventricles, which work in coordination to keep blood flowing efficiently. Our heart pumps blood 72 times per minute, about 1 lakh per day. When the heart pumps blood, a large blood vessel known as the aorta carries this oxygen-rich blood to various body parts. The heart muscle, like every other organ in your body, needs oxygen-rich blood to survive. Blood is supplied to the heart by its vascular system called coronary circulation. The aorta gives 3 branches to the heart through 3 main coronary blood vessels, also known as coronary arteries. The 3 most prominent and most important coronary arteries are LAD, RCA and LCX, and they play a crucial role in ensuring that the heart muscles receive an adequate amount of blood supply to function correctly. However, when our lifestyle choices are unhealthy, it can lead to blockages in these coronary tubes. This disease is known as coronary heart disease or coronary artery disease or ischemic heart disease. These blockages start occurring even before the age of 20 years. However, they do not affect the daily activities of a person until it reaches 70%. In our day-to-day activities, the heart requires a blood flow of only 10 to 30% for sitting, walking or jogging. Hence, a person rarely realizes any heart problem until it reaches 70% of the blockage. The most common symptoms of coronary artery disease are chest pain or tightness in the left side of the chest, discomfort in the same area, shortness of breath, choking sensation, palpitation, jaw pain and pressure that can also spread to the legs or arms. These symptoms are medically termed as angina. In rare cases, angina can also be a burning sensation or squeezing in the middle of the chest or right-sided chest pain, shoulder pain or back pain. Now, let's understand what a heart attack is and why does it happen. A heart attack is a deadly medical emergency where your heart muscles begin to die because it isn't getting any blood flow as the blockage has become 100%. Mostly, it is due to a clot formation following a rupture of the membrane covering the blockage due to the continuously increased stretching of the membrane. This clot closes the space between the block and the wall of the tube, leading to a complete closure of the tube. Now, without a blood supply, the patient experiences a heart attack. Without any blood flow, the affected heart muscle will begin to die. If blood flow isn't restored quickly, a heart attack can cause permanent heart damage and death. How do we know about your heart health before it's too late? The arteries that carry blood to your heart are examined with a computer tomography, CT scan or coronary scan. The test reveals whether there are any blockages, where they are located, how much stenosis there is, and the type of plaque present. This test does not require recuperation time because they are advanced non-surgical treatment and done without surgery. This is a more reliable test that is inexpensive, easy, requires no hospitalization, has little or no complications, and is highly recommended. Other than this, some critical parameters that need to be examined are lipid profile, blood sugar, blood pressure, and weight. If they are on the wrong side, further tests like ECG and TMT or exercise stress tests are indicated. Before we go for heart-related tests, it is better to take a thorough history of the patients, including family history, history of smoking or tobacco consumption, history of physical exercise, stress-related questions, etc. to determine the root cause. Why do blockages happen? 2 main fatty substances that create blockages in the heart are cholesterol and triglycerides. They are present in our food and are also manufactured in our bodies in large amounts. Those who are genetically prone to develop heart diseases have an extra capacity to manufacture these two kinds of fats internally. Reducing them is vital to prevent heart disease. Cholesterol produces LDL or low-density lipoprotein, which ultimately causes the blockage. Thus, reducing cholesterol also leads to a reduction of LDL. Intake of cholesterol can be reduced by avoiding cholesterol-rich foods, including animal foods like meat, fish, and eggs. One should intake only skimmed milk. Cholesterol in the blood should ideally be 130 to 200 milligrams per deciliter. However, to prevent heart attack, it should not exceed 130 milligrams per deciliter. Triglycerides, on the other hand, are present in all kinds of oil. Triglyceride count in blood is in the range of 100 to 160 milligrams per deciliter. But to prevent heart attack, triglyceride should ideally be less than 100 milligram per deciliter. Triglyceride levels in the body can be controlled with zero oil cooking, which has been widely popularized by SAAOL. HDL or high-density lipoprotein is known as good cholesterol because it absorbs cholesterol from the blood and takes it back to the liver. HDL is naturally produced in the body and cannot be taken from outside food sources. The only way to increase HDL is through physical fitness, increased intake of green leafy vegetables, stress management, and weight loss. Maintaining an HDL versus cholesterol ratio of 25% and above is favorable to preventing heart disease. Apart from the fats or lipids, there are 6 more factors that amplify the pace of blockage development. These factors include high BP, high sugar, tobacco or smoking, alcohol, obesity, and stress. Blood pressure and sugar levels should be maintained as shown. Tobacco consumption in the form of zarda, gutka, keni, etc. must be stopped. Smoking increases the probability of heart attack by 3 times. Alcohol also leads to blockage due to an increase in triglycerides. Obesity or being overweight also speeds up blockage formation. The best way to prevent heart disease is to keep a BMI of 25 or below. BMI is calculated as the weight in kg divided by the square of height in meters. Stress is a significant cause of heart diseases. It can increase BP, sugar, smoking, alcohol intake, cholesterol, and TG. Stress results in unlimited food intake and can also decrease HDL. So, can you fix your heart without bypass surgery? How can you reverse heart disease? For every heart patient, irrespective of this stage of blockage, prevention and reversal are very much possible. Let's understand the theory behind this. Firstly, we can reduce further deposits in the arteries that cause blockages by cutting down the fats completely. This helps in preventing heart disease. Second, the multiple factors that lead to the speeding of heart blockages, such as BP, cholesterol, diabetes, smoking, alcohol, obesity, or stress, can be controlled through allopathic medicine. Most importantly, inculcating practices such as reduction in fats, physical fitness through walking, yoga, and exercise, and a well-balanced diet can help reverse heart disease. In short, if we can stop further blockages, the chances of bursting the membrane will reduce by 50%. This is known as the prevention of heart disease. If we take additional measures to remove some blockages from below the membrane through lifestyle changes, we can reverse heart disease, where the chances of a heart attack are reduced by 99.99%. How can you assess the risk for heart disease? After more than 30 years of research, Dr. Bimal Chhajjar has developed a proprietary technique to guide patients and help them follow the reversal therapy via lifestyle changes and medicines known as the SAAOL Safety Circle. This scientifically proven technique can be used by heart patients to check the status of their disease control. It contains 14 spokes in a wheel where each spoke represents a risk factor with parameters like cholesterol, triglycerides, cholesterol HDL ratio, BP, sugar control, BMI, intake of fats or oils, consumption of fruits and vegetables, intake of animal foods, yoga-based exercises, meditation, walking, tobacco consumption, and stress management. At any point in time, based on the existing condition of the patient, these risk factors may be analyzed to assess the risk of heart disease. There are 3 zones in this chart: red zone indicating a high risk, the yellow zone indicates a medium risk or prevention range, and the green zone indicates the lowest risk or reversal range. Let us understand this better through an example.
Hi, my name is Manish Sharma. I'm 56 years old. When I visited SAAOL for the first time, my LAD was 80% blocked. the distal LCX 90% and RCA 90% blocked. I have high BP and also smoke frequently. My lifestyle is not very active. I undertook EECP and detox therapy at SAAOL for 40 days. I followed the routine of SAAOL Safety Circle. I walked for 30 minutes every day. I ate zero oil cooked food and practiced yoga and meditation for 30 minutes on alternate days. I also quit smoking. After following this routine and undergoing treatment with SAAOL, my LAD is now normal. Blood pressure has become normal. LCX 50% and RCA is 50%. Overall, the blockage has reduced and heart pumping has increased from 30% to 49%.
Now, let's look at the SAAOL treatment ecosystem. At SAAOL, we have devised a unique treatment ecosystem with 5 key elements that actively focus on heart disease reversal. First, enhanced external counterpulsation or EECP is an advanced non-surgical treatment technique that is used to reduce the frequency and severity of angina attacks. It is commonly known as natural bypass since it stimulates the collateral flow of blood and boosts the circulation of blood flow in the body. EECP is an FDA-approved advanced non-surgical treatment that is cost-effective and has no pain or side effects. With EECP treatment, patients experience an increase in energy, which helps them walk longer distances without feeling any chest pain. Second, SAAOL Detox Therapy detoxifies the body using a time-tested combination of intravenous allopathic medicines. This therapy not only detoxifies the body from impurities, but also supplies the body with micronutrients that rejuvenate our body. This therapy speeds up the reversal process by reversing diet and aggressively modifying heart risk factors through lifestyle changes. Third, allopathic medicines form an important part of our treatment ecosystem and help us maintain BP, sugar and lipids and control angina instantly. Fourth, eating oil-free food or cooking food with less or no oil is one of the secrets to staying healthy, especially for heart patients. Doing this will not only make the food taste better but will also give you a healthy lifestyle. SAAOL Zero Oil Cooking is not just a cooking method, it's a way of life. It will help you to live a longer, healthier, disease-free and fit life. Fifth, lifestyle management forms the foundation of healthy living. Through stress management, education, nutrition, regular exercise and yoga, not only can we reverse heart disease but also manage other chronic and long-term illnesses. Ask your SAAOL doctor to learn more information about your best treatment plan. Let us together improve your heart health the SAAOL way. To book an appointment, call us today.